Hi, can you go ahead and introduce yourself?
Sure. My name is Schroeder. I have a DNP in nursing, and I also have my master's in nursing and my RN, and I hold an inactive LPN license or LPN license.
Awesome. So before we begin the interview, is it okay if I record?
Yes, it is.
Okay. So why did you choose to get your advanced practice degree or doctorate degree in nursing?
Well, I decided to go back to get my final terminate degree in nursing because I have 4 generations of nursing background, and so I wanted to continue that and actually obtain my doctorate in the area that I am very passionate about.
Oh, cool. And what goals or what 3 goals have you accomplished with this degree?
Well, 3 of the things that I've accomplished with this degree is that it has allowed me to explore a lot of avenues in nursing. I took the nurse leadership route, so I've done management both at the bedside as well as at the corporate positions, and I've actually transitioned into healthcare informatics, which allowed me to incorporate computerized documentation, which is another passion of mine, and move that into clinical practice across the country.
Nice. What was the hardest part about obtaining your degree?
The hardest part of obtaining my degree was actually fighting for the right to go back. I was a high school dropout and then joined the military. And when I came out of the military, I fought to get into the LVN program, and then I fought to get into the RN program, and then the master's, and as well as the doctorate. Once you're a quitter, apparently they keep that label forever. So your record does follow you.
And where do you think nursing is moving with higher education, and why?
Well, I think that healthcare has kind of changed throughout the 30 years I've been in nursing. And so what I see now is, instead of us just being bedside caregivers, we're moving into leadership roles, which I think is excellent, because who knows the patient better than we do?
Right.
Because we're at the bedside all the time,
Right.
And so we can help make decisions that are more informed and actually, impact the patients and their outcomes. And I think now that healthcare is really moving along that same track, we're both looking at quality outcomes, that we'll see nurse practitioners moving into roles where they're like the general practitioners or the gatekeepers for the patient and then they'll get sent off to their specialist, but everything will come back to that nurse practitioner or the GP to kind of manage their care, because our goal is to cut down on healthcare costs.
Right. And what is your definition of professionalism?
My definition of professionalism is 1, be on time,
Right.
Okay, which most of my students know that. The other thing is to hold yourself as accountable as you can, because the accountability of you as a person and as a professional will depend on a lot of factors. 1 is making sure you're on time, that you relieve the others the way you need to, that you treat your patients with respect, and that you do no harm.
Right.
So the philosophy I would have is that you do unto others as you would have done unto you. And even though it's a very simple philosophy, it's one that still holds true very much in my profession now.
Yes, definitely a good philosophy to have. What advice would you have for a senior nursing student?
For a senior nursing student, explore. Don't set your sights on one thing and never look at other opportunities, because really, until you get in there and really try it, you'll never really know what your passion is. But once you do determine it, then stick with it. Continue your education, or whether it's formally or whether it's through association with other professionals, and just keep that knowledge base going, because that's the only thing we can do.
Yeah.
And healthcare changes every day.
Right.
So.
We're always learning. What is your nursing philosophy? I think you kind of answered this earlier. But.
Yeah, my nursing philosophy really revolves around change. So I actually believe that one of the things we can't do is stagnate. So we have to incorporate new ideas and new theories and practices. And that's one reason why my role as a DNP is so unique, because I may not do the research, but I take the research and help facilitate getting it into the bedside practice. And to me, that's one of the best roles that you can have as a nurse, because you're helping the caregivers and the patient.
Yeah. And what makes your degree different from others?
I think I just answered that with that last statement there. But, you know, I think that the degree, it really depends on the individual. I think that you can get any degree, but it's how you put it into play that really, you know, changes you and changes your philosophy.
Awesome. Well, thank you so
Okay.
much for taking the time to answer these questions.
All right.